This video is a brief description of optimal targeting scheme. Before we get into what is an optimal targeting scheme, let's look at this slide and it lists other targeting schemes based on their hierarchy. As you can see, currently optimal targeting is at the top. It's more advanced than adaptive targeting, servo, dual, and set point, where set point is the most basic form of targeting. In the next slide, I'm going to compare and contrast set point targeting with optimal targeting to get a better understanding of the interactions of an optimal targeting scheme. Adaptive support ventilation, or ASV, is a mode of ventilation that uses an optimal targeting scheme. If we were to classify ASV, it would be a pressure control IMV mode of ventilation. To further classify ASV, we need to classify the targeting scheme it uses, and it uses a optimal targeting scheme. So that's why I put the two O's there. And what the two O's are referred to is it uses an optimal targeting scheme for the mandatory breaths and an optimal targeting scheme for the spontaneous breaths. As mentioned, I'm going to compare optimal targeting with set point targeting. Now here's a slide of SIMV pressure control. If we were to classify this, even though the manufacturer says the mode's this, if we look at the basic components of the mode, it's going to be pressure control, IMV, and then the targeting scheme it uses is set point and set point. And the set point is for the mandatory breath, and the set point targeting is for the spontaneous breaths also. Let's review a couple of the settings, and let's look at the mandatory breaths here. And there's all the settings that the operator has to set with set point control. The operator has to set a pressure level, has to set a respiratory rate, IE ratio, or inspiratory time, how the breath's going to rise. This is the pressurization rate, or the rising time. And this is a safety for the breath cycle on how the breath is to end. And then for the spontaneous breaths, so here's my spontaneous breaths right here. The operator additionally has to set the trigger, what pressure support level to give, and how the breath is going to end. And now let's compare this to an optimal targeting scheme. Now these are all the controls in ASV that the operator has to set. And this is for both the mandatory breaths and the spontaneous breaths. And it's stated that ASV, if we were to classify it in its basic components, it's a pressure control IMV, and then the targeting scheme is optimal for both my mandatory breaths and optimal for my spontaneous breaths. And let's look what the operator has to set for both the mandatory and the spontaneous breaths. And the 100% minute ventilation is for both mandatory and spontaneous breaths. The pressure, or the PASV limits for my pressure limit, that's for both. The P ramp, or the pressurization rate or rise time, is for both my spontaneous and mandatory breaths. And of course, my PEEP and oxygen. Now for my spontaneous breaths, the only thing I'm going to set is a ETS, or this is my expiratory trigger sensitivity here on how the breath's going to end based on flow criteria, and the patient trigger. As you notice, compared to my traditional set point, the operator is not setting this is what the operator does not set, and I'm just going to put that in white. So the operator does not set a respiratory rate, or frequency, a tidal volume, IE ratio or inspiratory time, as you saw with the traditional pressure control IMV. The ventilator automatically sets these set points. It's always monitoring the patient, and instead of the operator setting these, the ventilator is going to set them based on mathematical models and optimization. Chatburn describes optimal targeting scheme as a ventilator control system that automatically adjusts the targets of the ventilatory pattern to either minimize or maximize some overall performance characteristic. ASV uses the Otis equation to calculate the least work of breathing based on the patient's expiratory time constant. And it uses this to automatically adjust certain targets: tidal volume, a frequency, and even a IE ratio. Now, these two screenshots represent the least work of breathing model. And I'm just going to enlarge the top one real quick. Let's make this one smaller. And highlight this one. We'll make this a little larger. So look at this. So this is a patient with pretty normal lung mechanics. And what the ventilator is doing is it is targeting a certain tidal volume. As you can see, it's a pretty average tidal volume. This is an adult patient for the minute ventilation setting. So this is the target, what the ventilator wants, and this is the current. So here's my two columns. And it gives a respiratory rate to get that minute ventilation, and it sets my inspiratory time also. And then in my graph over here, this is kind of least work of breathing graph. And this plot right here is the target and the patient. And this graph represents, for these patients' lung mechanics, this is the least work of breathing pattern. A respiratory rate of approximately 513 and a tidal volume of 513 and a respiratory rate of 14. Okay, let's enlarge the second. This is my second example, and this is a patient actually with a obstructive airway disease. And the operator set the same minute ventilation. As you notice, the tidal volume is higher and the respiratory rate is lower. And I have the same inspiratory time here. And this allows for more expiratory time, more emptying for the obstructive process because I have a much lower respiratory rate. And as you can see, they plotted the least work of breathing on this patient here, this ventilatory pattern. A optimal targeting scheme, the ventilator automatically adjusts the targets to either minimize or maximize performance characteristics. As you can see with ASV, it's trying to minimize lung injury. It's trying to maximize ventilation. It's trying to minimize also rapid shallow breathing. And it tries to minimize intrinsic PEEP. And it tries to provide a ventilatory pattern, the least work of breathing, to the patient. That was my short, brief description on optimal targeting schemes. To learn more about optimal targeting schemes, you can review my videos or my playlist on adaptive support ventilation. Thank you.